All right, so just a brief one. We get to look at the introduction and definition of what congenital anomalies. Okay, so yes, after looking at the introduction and definition, we also look at what some various types of terminologies that are used when you are talking about congenital anomalies. Okay, so congenital anomaly, like you see this one, what do they call this? They call this a cleft palate. Okay, this one is, to be specific, is actually a unilateral one, just one side. Okay, if it's two side, then much more bigger problem. So the thing is, these congenital anomalies, the definition is, first of all, the word congenital. If you say something is congenital, uh, if you say something is congenital, you mean to say that the person was actually what, born with that thing. Do you understand? You mean to say the person was born with that thing. Okay, so congenital means born with. Okay, so it doesn't actually imply or exclude a genetic basis for the birth defect. Okay, congenital anomalies are what, anatomical defects that are present at birth. Okay, so on estimate about 120,000, that's in about, if 33 babies are given birth, at least one of them is born with a birth defect. Okay, each year in the United States. So they are okay. They are the most common cause of mortality in the first year of what you've been giving birth, and it contributes what to morbidity and mortality throughout the early years of life. Okay, so if you hear that a baby died, is roughly due to this. Sometimes it might not be a congenital anomaly like we see outside. It could be something internal. Do you understand? So for the various terminologies that we can actually use when talking about congenital anomalies include things like malformation. So mal means something was not formed properly. Do you understand? So this one is primary errors of morphogenesis in which there is an intrinsically what abnormal development process. Then when you talk about things like disruption, if you talk about things like uh, disruption, just like the name implies, to disrupt, to scatter. Do you understand? This one is secondary destruction of an organ or body region which was previously normal. Do you understand? The body region was previously normal, but later on in life now, something scattered it. Do you understand? All right. And this could be from extrinsic disturbances in morphogenesis. Okay. Then you can also have what deformations. So deformation is like you deform something. It's a particular area that is deformed. Okay. So it could be localized or generalized compression of what the growing fetus by abnormal biochemical forces, leading to varieties of what structural abnormalities. Okay. So they also represent an extrinsic disturbance of development and not an intrinsic error. Okay, so deformities is actually something that happened on the outside. Okay, the sequence. When sequence is just talking about what a step by step. Okay, this thing happened, so this thing led to this thing. One thing led to one thing. Do you understand? Then the syndrome. Syndrome is like an umbrella. Okay, if you say Down syndrome, there's so many things that comprise Down syndrome. Do you understand? So syndrome simply means so many things being compiled together then called one name. Okay, the agenesis is when there's a complete absence of an organ. Do you understand? All right, so I think that's it for the introduction and definition of the concept of congenital abnormalities. So we actually have like some couple of, I think roughly 40 videos to do on what congenital anomalies. All right, so stick with us.